topic is Lyme disease, and it is a spirochetal illness that is transmitted by the bite of a deer tick, and it is a hot topic around here on Cape Cod. And it is now really the most common vector-borne disease in the United States. It was first identified in 1975 in Lyme, Connecticut, and that was because all of a sudden they started seeing an unusual clustering of arthritis in children, which then led to an investigation and leading to the discovery of Lyme disease. It is not just a local disease related to the bite of the tick, but it also creates and becomes a multi-systemic disorder. The causative organism is the Borrelia burgdorferi, which is present in the United States and Europe. There are some other organisms in Europe only. There are the Borrelia garini and the Borrelia afzeli. Now, that is, again, the causative organism, the spirochete. That spirochete then infects the tick. That tick then infects other animals and people. The most common ticks that do this, and especially in New England, in central United States, is the deer tick. In other parts of the country, it may be the black-legged tick, and in Europe, it may be the European sheep tick. But just to be clear, it is the spirochete, the burgdorferi, that is the infectious agent that then infects the tick that transmits it. And here you have a picture of the wonderful tick that creates so much problems. In order to be infected, you have to have three elements for having Lyme disease to exist. First of all, you have to have the infectious organism, which is the burgdorferi. And then it has to have a host, a place to live. And that host is usually the white-footed mouse or the deer tick. That is the reservoir when we talk about that chain of infection for this spirochete. What happens then is a deer tick, or one of the other ticks that we've identified, feeds on that white-footed mouse. It also can feed on the deer tick, and it also is found in birds. So these ticks can feed on birds and get infected with the bee burgdorferi. They then fall off these host animals. They go through a period of time, and then they can then attach to other animals that can get infected with Lyme disease and humans and transmit it. That tick does tend to feed on mice, dogs, cows, horses, deer, and humans. Wild animals do not exhibit the illness, however, so you can't tell, okay, are the deer around here sick? No, they're not going to exhibit the illness of Lyme disease. Clinical Lyme disease does occur in some domestic animals, so your pets can have it, but but they do not directly transmit it to their caretakers. Okay? The only problem is if you've got a pet with ticks, they're going to bring the ticks in the house, and then you're most likely going to get attachment to a tick and get the disease. Person-to-person transmission does not occur, and it most frequently happens for humans during the summer months. Ticks, for the transmission, can attach to any part of the human body. The problem is they often attach in hard-to-see areas like the groin, the armpits, and the scalp. The issue is that the tick must be attached for 36 to 48 hours or more before that Lyme disease bacterium can be transmitted. The biggest problem is that most humans are infected through the bites of immature ticks, and those immature ticks are called nymphs. And nymphs are very, very tiny. They're less than 2 millimeters. They're hard to see, so a lot of people don't know that they've had a tick attached to them. So it's usually the ticks. The ticks are the nymph size of the ticks, which are the small ones, are usually attaching to people during the midsummer, and they're are very, very active in temps above 35 degrees. Adult ticks can also transmit them, but they're larger, so you're more likely to see them. So you're most likely to be able to then find them and remove them before they can transmit the bacteria. The adult ticks are more active in the cooler months of the year, so they're usually early spring and late fall. Are there other ways that you can get transmission of the Lyme disease? This person to person, there's no evidence that it's transmitted from person to person. During pregnancy, if someone gets Lyme disease, it can lead to infection of the placenta and a possible stillbirth. However, if that mother is treated effectively during pregnancy with appropriate antibiotics, there are no effects on the fetus. There's been questions about the blood supply. There's no cases of Lyme disease having been linked to a blood transfusion. However, they have found that Lyme disease bacteria can live in blood that is stored for donation. But again, no evidence that a person has gotten the Lyme disease. If someone has Lyme and is being treated, they should not be donating blood. However, if someone has been adequately treated for Lyme and they've recovered, they can be considered as a potential candidate for a blood donation. Now, we mentioned that some of your pets, cats and dogs, can get Lyme disease, but again, they do not spread it directly to their owners. Again, the problem is the animals come into the house. They also bring in their friends attached to them, their ticks. Those ticks fall off and then attach to humans. Eating wild animals like squirrels or venison will not give you Lyme disease, but you should also make sure that you're always cooking them carefully and completely. There is no evidence that Lyme is transmitted through the air, in food, water, or from mosquitoes or fleas or lice. The other thing is we also see dog ticks around here, that American dog tick. There is no evidence that American dog ticks carry the B. burgdorferi spirochete. Lyme disease has 3 stages. There is an early localized infection, there is an early disseminated Lyme, and there is a late infection. With the late infection, sometimes that can progress on to being a persistent infection that we will talk about. With early localized infection, the most common thing people are complaining about or they're seeing is that red expanding rash called the erythema migrans, otherwise called EM or ECM. It's important to differentiate that type of a rash from the reaction to a bite. Some people, if they get bitten by a tick, just have a small bump of redness that usually goes away in about 1 to 2 days. It's like a mosquito bite. It does not enlarge. It doesn't stay around for a long time. So that is not the EM rash that people are complaining about. That's a reaction to a bite. But even if you get bit by a tick, you do have to be careful because ticks do carry other diseases other than Lyme disease. There are also some more systemic problems that people may have, a viral syndrome where they have fatigue, chills, a fever, a headache. They feel like they have the beginnings of a flu or a cold with muscle joint pain and swollen lymph nodes. Those generalized symptoms that may indicate somebody's getting an infection. The EM or the bullseye rash, not everybody gets that rash. You can read a wide range of people saying how many people get the rash, but in general it will run from 70 to 80% of the people who are infected with Lyme's disease have the EM rash. And that does begin at the site of the tick bite. It may start 3 days after the bite and take up to 30 days to form, but most of the time it will form within 7 days. That rash gradually enlarges over a period of several days and may get as large as up to 12 inches. And as what happens in the beginning, and as it progresses, I should say, it tends to clear in the middle, so it has that bullseye appearance. It's warm to touch, but people rarely complain that it is itchy or painful. And they can appear on any part of the body. Now, it's important to realize that these symptoms, these viral symptoms and this rash will disappear over a period of weeks or months, even if it is untreated. So if you have the rash and it's gone away, a person needs to know that they shouldn't think that the disease has gone away. They still have the disease, but those symptoms have abated. Then if the person is untreated, they may progress to early disseminated Lyme, which may be days to weeks after the tick bite. That what happens is that infection spreads from the site of the bite to other parts of the body. And you get a lot of different signs and symptoms. They may have those EM lesions in other parts of the body. One of the classic things sometimes you hear about is people developing Bell's palsy, which is a loss of the muscles on one side of the face, muscle tone, so they have a drooping on one side of their face. They may complain about severe headaches or neck stiffness because they may start having an inflammation of the spinal cord. Some pain and swelling in their large joints like the knees. Some shooting pains that can a lot of times interfere with sleep. And they may have some heart palpitations and dizziness. Many of these symptoms, however, resolve over a period of weeks or months, even if they are not treated. However, if they are not treated, we can go on to having further complications. And in late disseminated disease, which may be months to years after a tick bite, about 60% of patients untreated start to develop problems with intermittent bouts of arthritis. They have severe joint pain and swelling, and again, the large joints. The other thing is 5% of those untreated patients can develop chronic neurological complaints months to years after that infection. Shooting pains, numbness and tingling of the hands and feet, and problems with short-term memory. There is also a process called post-treatment Lyme disease syndrome. And that happens when a person has been treated for Lyme disease with the correct antibiotics, and it may occur in about 10 to 20% of the treated patients. And they tend to have lingering symptoms after this treatment. They may complain of things like joint pain, some cognitive defects, and sleep disturbances. And one of the big ones I hear about are the fatigue. However, there is absolutely no evidence that shows that these are due to an ongoing infection with the Burgdorferi, that spirochete. So they don't believe it's because the person is still infected. They are thinking, and there is some evidence, that it's more related to being an autoimmune response, so that your body is doing damage to their body's tissues even after that infection has cleared up. A lot of times people want to keep taking those antibiotics. I don't feel good, I'm feeling awful, antibiotics are supposed to cure this, so I need to take more. But again, most of the evidence states that the Burgdorferi, the infection, is no longer there. And most of the studies have shown that continuing with antibiotic therapy does not help in clearing up this post-Lyme disease syndrome. And actually, if continuing on the antibiotics can cause more harm than good. The good news, though, for post-traumatic Lyme disease is that most of the patients get better with time. That's the hard part, with time. And it can take months for somebody to feel completely well. And that's the frustration of a lot of patients that we see with post-treatment Lyme disease. What you also, with diagnosis, it is basically based on the signs and symptoms. Some of your lab tests, the CBC and the SED rate, are usually normal, but in order to diagnose somebody with Lyme disease, there will be the signs and symptoms, and a two-step lab process if they decide to go that route. The first step is an enzyme immunoassay, which will have positive results for most of the people that have Lyme disease. If it tests negative, they do not need further testing. If that first test with the ELISA is positive or inconclusive, they will follow up with a Western blot to make sure and confirm that infection. There are a lot of different tests out there. If you go to the CDC website, they will go through a lot of those tests, because a lot of the tests that are being done out there, such as the antigens in urine and lymphocyte transformation tests, have not been validated by the CDC. Testing of ticks. That's a question we frequently get. I now have my tick. I removed my tick, and now what do I do with it? Should I get it tested? The problem is if the tick does test positive, it doesn't mean you're infected. It has to be attached to you for a length of time before it can transmit the infection to you. So that's not really going to tell you, and often you may have signs and symptoms before you get the results of the tick bite, of what the tick is back. Also, negative results if the tick comes back as being negative, doesn't mean if you're having symptoms that you don't have Lyme disease. You may have been bitten by another tick that you were unaware of. The only reason you may want to keep your tick and save it, and all you do is when you're removing it, put it, tape it to a piece of paper and put it in a small container. You can put it in a baggie, you can put it in a glass jar and keep it. Purpose for that probably is to really identify that it was a deer tick. Sometimes we wonder, what kind of a tick is it? Is it a dog tick, a deer tick? So that is the advantage of that. And you can test it later if you feel you need to do that. As far as treatment for Lyme disease, pharmaceutical treatment, appropriate antibiotics in the early stage of Lyme disease, people usually recover rapidly and completely. Most of the time in the early stages it is oral treatment that may be doxycycline, amoxicillin, or cefuroxime. Some people ask about prophylaxis. And by prophylaxis, I mean, okay, I'm out in areas where ticks are all the time. Should I just take some antibiotics to cover me so I don't get Lyme disease? And the answer is no. If you're at risk for getting tick bites, you need to do some of the things we're going to talk about in a little while about prevention. But taking low doses of antibiotics over a period of time are not suggested. How about if you find a deer tick on you, but you're not having any symptoms? So you have an embedded deer tick and you don't have any symptoms. Should I start taking antibiotics? And the answer is no. Again, it has to be attached for more than up to 36 hours. Okay. The only reason that they may possibly put somebody on antibiotics is if they know for sure that the tick has been attached for more than 36 hours. Now that's kind of hard because most of the time once you find a tick you want it out. So when you find a tick you don't know how long it's been there. Also, in order to have prophylaxis at this stage, the tick must be engorged to indicate that it has been feeding, and it must be in an area that Lyme is endemic in the tick, the B. burgdorferi is endemic in the ticks, and that's greater than 20%, which is New England. With early Lyme disease, the treatment is usually doxycycline, okay, or amoxicillin, okay, for usually 14 days, but it may go up to 21 days. And also, if someone is pregnant, they should be treated. They usually will not use doxycycline in pregnancy or in children under the age of 8. So that means then you're going to look at some of the other antibiotics that are approved, like the amoxicillin or the cefuroxime. With disseminated disease, the early disseminated, if there is a Lyme meningitis that's being exhibited, you will then possibly see the use of antibiotics IV, and that's usually ceftriaxone. And that may be intravenously for 14 days, but may go up to 28 days. If that is not an option, doxycycline may be used orally. You will not usually see doxycycline given IV because it is well absorbed orally. With Lyme carditis, what you may see again with Lyme is either oral or parenteral antibiotic therapy, again 14 to 21 days. In late-stage Lyme disease, it is interesting, they usually are treated successfully with antimicrobial agents orally. And again, that's usually doxycycline. And usually, if it's the late stage that it's being treated for, 28 days is recommended for adults. So that is usually the treatment for the Lyme disease. As far as prevention is far better than getting treated. What you will have, try to avoid finding the ticks and getting ticks to attract you. So take care of the personal property. Keep a lot of brush cleaned away. There is a product called Daminix that can be put in little tubes, and these little white-footed mouse can make their homes in them, and they kill the ticks on them, or other pesticides in the area. If you are walking, okay, in areas that have ticks, walk in the middle of the path. Don't brush up against the bushes. Remember, ticks do not jump. They only crawl onto you. And if you are in an area with ticks, have frequent visual inspection of your skin and the clothes. Find them before they attach so you can get rid of them. And if you do have an attached tick, remove it promptly. And we'll talk about how to remove a tick. Dress protective clothing. If you're going to be out in an area, long-sleeved shirt, long pants, tuck your pants into your socks. Some people will even put duct tape around that joint of where the socks meet the pants. Okay, so ticks can't get in there. Wearing white colored clothing, that gives you a background so that you can see a tick. There are some studies that have been found that the tick probably is attracted to some of that light-colored clothing more than darker-colored clothing. But the recommendation is still that you wear light-colored clothing. They need to validate this more, and the bottom line is it's easier to see them on light-colored clothing. You can protect yourself with an insecticide. Your tick repellents are usually DEET that should not be more than 20 to 30% in strength. Okay, if you find anything any stronger than that, it should be just put on your clothes, not on your skin, because it can cause some neurotoxicity. So therefore, again, follow the directions. Reapply it as the directions say on the bottle that you're using, because it does vary with each product that you're using. And again, children, do not put it on anyone under the age of 2, and it should not be on the face or the hands. Once one comes in, they should wash the areas that the DEET has been applied to. It also should not be applied to any abraded or irritated skin. There is another product out there called the Promethean. That does kill the ticks on contact, which isn't available, but it only goes on clothing, and it is a spray. If you put it on your skin, it is inactivated by those skin lipids. When we're coming to removing the tick, how should you do it? All those wonderful old wives' tales really do not work. You should just use those fine-tipped tweezers and grasp it as close to the skin as you can get and pull upward with a steady, even pressure. Don't jerk it. Don't try to pull it out, because a lot of times that leaves the mouth parts in and you only get part of the tick. If you're unable to remove it easily with clean tweezers, leave it alone and let the skin heal the mouth. That's only if you're left the mouth parts in. After it, clean the area and your hands with rubbing alcohol or iodine. Scrub it with soap and water. Don't paint the tick with nail polish or petroleum jelly or things like that. The goal is to remove that tick as quickly as possible and not waiting for it to detach. Thank you, and have a good day.